What is Strangles? Strangles, also known as equine distemper, is an upper respiratory tract infection caused by a bacteria by the name Streptococcus equi. This infection causes the lymph nodes of the horse to swell and abscess. Strangles is enzoonotic and highly contagious. There are a few types of strangles. Some include bastard strangles, occurs when internal lymph nodes are involved. I don't know how to say that one. Okay, it's Purpura hemorrhagica. Purpura hemorrhagica is when immune complexes get trapped in capillaries and causes an acute inflammation, seen as red spots on skin and mucous membranes. Yes!
Fun fact, did you know that strangles is the most common bacterial infection of horses?
The signs and symptoms of strangles. Horses of all ages can get strangles, but horses under 5 years old and yearlings are the most susceptible. Horses usually show signs within 3 to 14 days. The symptoms for strangles include loss of appetite, depression, fever, soft cough, runny nose, and slight swelling of the lymph nodes. This progresses into abscesses on the lymph nodes at the back of the throat and between the jawbones. Since the lymph nodes are so swollen, they will obstruct breathing, hence the name strangles. The abscesses will burst, and this will release the strangles bacteria. The bacteria that causes strangles, Streptococcus equi, can only survive 6 to 8 weeks in the environment.
Fun fact, infected horses can still be contagious for up to 6 to 9 weeks after symptoms dissipate. Up to 10% of recovered horses become carriers.
There are 2 different ways to contract the disease, direct and indirect. In the direct way, an infected animal comes into contact with a non-infected animal. With indirect, the horse comes into contact with contaminated items such as stables, feeds, walls and doors, pastures, fences, but is most commonly spread through shared water.
Fun fact, strangles is only fatal in 1% of cases, but there are complications in approximately 20% of all strangle cases.
The treatment for strangles. The best treatment for strangles is the preventative kind. Isolate infected animals and eliminate articles that come in contact with the infection. Antibiotics help reduce fever. Soft feeds and fluids can ensure proper nutrition, along with poultices to hasten the process so abscesses can be drained. Antibiotics are not very useful during the majority of the illness, but after the abscesses rupture, they can be used to prevent further infection. It is helpful to promptly burn all articles that come in contact with pus, as to minimize the spread.
Fun fact, antibiotics are not given unless the case is very severe, as it can block the natural immunity from developing and the horse may get strangled again.
Strangles prevention.
There are 2 types of vaccinations for strangles, a dead and a live. The live vaccine was introduced much more recently and is administered intranasally, which has made it more popular than intramuscularly injected dead vaccine. The dead vaccine on occasion can cause purpura hemorrhagica. Detecting the carriers of strangles also plays a key role in its prevention. Research shows that carriers are usually horses where infection persists in the guttural pouch. Cultures and PCRs should be taken to determine if they are carriers. If positive, chondroids should be removed and guttural pouches treated by flushing with penicillin G. Carriers should be treated with penicillin G intramuscularly for 7 days and isolated for 30 days. Fun fact, foals 4 months of age and under are usually protected by the colostrum received by their mother's milk. Did you know that the French word for horse is cheval?